Sri Ramachandra Institute of Higher Education, India. And is the slide visible?
Yes, you can begin.
Yeah, so I'm here to talk. I'm basically an audiology and speech language pathologist. So the topic here is more relevant to language therapy. So this is about synesthesia in children with autism spectrum disorder. And my observations related to language evaluation and therapy is what I'm to present here today. So moving on to understand what synesthesia is. Synesthesia is a non-pathological perception that happens when one particular sensory domain is stimulated, resulting in an involuntary participation of a secondary sensory pathway. So which means that the stimulus that is given to elicit a target response in a visual sensation is eliciting a response from an auditory sensation. So that is the kind of perception when we call it as synesthesia. So one such example we would give here is text causes a color or taste sensation. So we're reading a text might cause a color or taste sensation. So here the inducer is the stimulus. The stimulus induces that synesthetic sensation, and the synesthetic sensation is called the concurrent. And initial claims of this synesthesia as a falsified perception was there. And later on, because of the consistency in perception, the claims were proved false. So there are ways in which we can understand synesthetic experiences. As in, it is a process. It goes on. I'm sorry, I'm not able to move to the next slide. Yeah, there are developmental trends in the perception. So as we understand, there are lifetime changes that can happen, which means that the earlier stage during the infancy and early childhood, there is more synesthetic perception that's happening because of the denser synaptic connectivity, while later in life, because of the cortical organization, this perception is reduced. So almost general population would also have synesthetic perception. And how does that happen? There are two ways of understanding it. One is by a weak perception hypothesis and another by a strong perception hypothesis. The weak perception hypothesis put forth the limitation that infants process. So which means that the infants are born with limited ability to process sensory stimuli exclusively, and they process it as sum of energy, and cross-modal association is innate ability of this limited addition processing. While strong perception hypothesis puts forth understanding that more synaptic connections are present at the time of the infancy, and so this cross-modal perception takes place while the development happens. In the course of development, there are more specialized sensory perception that's happening, and so these perceptions are weighed with time. So moving on to our understanding, the topic as it says that synesthesia and autism. So what is autism all about? Autism is a neurodevelopmental disorder, and it typically manifests between 18 to 36 months. And what are the characteristics of individual with autism? Initially, there are three symptoms which has been reported then and there. They are called the cardinal features of autism: social communication, verbal communication, and stereotypic or repetitive behaviors. But then, thanks to DSM-5 for including this hyper and hyposensitivity, which is a marked feature or behavioral characteristics of individual with autism. So from that, we should also understand that reports from the literature states that 60 to 96% of children with autism in the autism spectrum have some sort of sensory processing disorder. And it is important to note that these deviants are not restricted to one particular sensory modality, but it is a sensory profile across the sensations: visual, auditory, tactile, olfactory, gustatory, and proprioceptive. And most important thing here is, given that they have these sensory differences, we should also note that these sensory differences are responsible for, or could be a reason for, the extraordinary skills they have. For example, music perception, hyperlexia, that is reading without pre-teaching. So those aspects are oftentimes related to this difference in sensory perception, and these can facilitate language, socialization, and independence in these individuals. So looking at a greater picture of how a language impairment would be in case of children with autism, most often times they have difficulty acquiring language itself, and most of them give a non-verbal profile. And if at all they acquire language and they are verbal, they have difficulty in verbal language, they have limited verbal language, they have formulaic utterances, they have repetitive vocal behavior, which is called echolalia, and they also have meaning association functions. And so they have predominantly need-based communication. And moving on to the intervention approaches for children with autism, most often times, or at least 70 to 80% of the time, behavioral techniques are on top of the table for intervening children with autism. It could be language per se, or their behavior itself in behavior therapy. Everywhere, the operant conditioning principle of stimulus response and reinforcement paradigm has been used. And there are also sensory based therapies which concentrates on one particular sensation. For example, we can call it as auditory integration therapy or vision therapy, which concentrates on one particular sensation. But then sensory perceptual strategies for intervention requires attention, and there are no and there are not greater initiation for that, because it is not respective it is not related to one particular sense. These individuals have difference in profile, but then there are different processing mechanism which they exhibit, and so they have different kinds of cognitive profiles. So in order to address that, sensory perceptual based strategies have to be incorporated. And we have moved to see synesthesia and autism, and now we would have to look at the similarities of synesthesia and autism, and how synesthesia favors learning in children with autism. So synesthesia, as reports suggest, synesthesia is 3 times more common in children with autism, and the commonality between both the condition is that atypical sensory processing. And more importantly, the extraordinary skills, like the Savant syndrome in the autism spectrum, is oftentimes related to the synesthetic ability, and it often acts as a mnemonic device for these children and aids a brilliant memory or a very good memory for routes or places or days, numbers, calculations, etc. And this also aids for perceptual differences. Because of this deviance in processing or difference in processing, they also have difficulty with, although there are positive sides, there are also different sides, as in the lacunas, like, they have different cognitive deficits and processing styles, and also they lack theory of mind, what we call it as. So theory of mind is knowing the other person's intentions. So those are some of the lacunas which this perception could also underplay. And it is also important to note that synesthetic abilities are being often associated with memory for numerals, exceptional memory for numerals. Given that all these factors are related to synesthesia and autism, there must be some amount of understanding of these sensory processing, so that targeted intervention can be provided to children with autism, exploiting these synesthetic skills. So when I talk about synesthesia, autism, and language therapy, my third segment of the title is language therapy and evaluation, right? So language and synesthesia should have some amount of synchronized characteristics for me to relate to it. So when I talk about that, the study of or the article of Ramachandra and Nahbad 2001 claims that language evaluation, the proto language evolution, would not necessarily be a natural selection, or would not necessarily be evolved because of a natural selection, but then there are synesthetic perception that explains language evolution. So in that case, they have 3 claims to say that. So one such claim is that visual representation of phonemes, the classic Bobo Kiki task, what we call it as, gives us that understanding. For any sound counter, there is an object appearance. So which means that sound and vision could be related. So sound is to be perceived auditorily, and your text or the object is to be perceived visually. But then individuals could actually orient the sound and the object. So that is the way they could internalize language. That's what the first claim is. The second claim is about sensory motor synesthesia, wherein for every verbal output there are auditory representation, and for every auditory representation of phonemes there are motor representations that is in the brain. So with each phoneme, like for example, when we dance for a tune. Similarly, when we make a sound, we say make a sound with a movement. So that is the kind of understanding how proto language would have evolved. And third kind of claim is that synkinesis, which involves two motor movements for a single word. For example, when I talk about me, when I say the word in English, me, I articulate it with my lips, me, and also I can point it with my index finger towards me. Okay, so there are two motor movements that are associated for particular words to internalize that word in a language. So looking on to other aspects of language and synesthesia, how synesthesia contributes to language. So language contributes to synesthetic perception because most of the inducers, as in those stimuli, are language oriented. So phonemes, words, letters, those are the inducers which often causes synesthesia, and that is how it is reported. And unmindful of whether children are autistic or neurotypical in nature, children generally use this as a mnemonic device to get abstract language. The initial language that a child develops is often abstract in nature. And synesthetic ability also plays an important role in perception, cognition, memory, creativity, and imagery. And most important of all, we should understand that synesthesia can explain us understand language processing. And it is also important to note that it can facilitate literacy and overcome semantic association difficulties. And oftentimes it complements verbal cognition, what we call it as. It can aid word and letter recognition, and it solves semantic mediation issues in case of children with autism. And again, when semantic mediation is nothing but meaning making difficulty. Meaning making difficulty is what children with autism experience, and this particular aspect of perception, synesthetic perception, can deal with it or help them deal with it. And one such terminology they report is ideathesia, which is nothing but a conscious process of associating meaning with a stimulus. And this occurs when there is semantic association difficulties in the process of language development. When a child has what we call it a semantic vacuum, when the child is with an ongoing stimulus in introduction, the child is not able to assign a meaning for a particular stimulus. That's when the child will actually go in for ideathesia, wherein the child over applies a particular word or particular concept what he or she acquired to name a stimuli or understand a stimuli. So with this, we'll move on to the case studies. I'm here to present 4 case studies. All these cases are incidental in case presentations and observations are incidental in nature. And the first child whom I wanted to talk about, and all the 4 of them have language disorder, and they were diagnosed with ASD as well. So the first child whom I wanted to talk about was diagnosed at the age of 3 years, and he was into regular therapy. And when I had to intervene him, I intervened him by 9 years of age. Till such time, he was there with other therapists who were handling him through behavior techniques as well. So he was not unattended. That's what I'm trying to mean. So by 9 years, when I reevaluated again, I identified the child to be a nonverbal child with autism and language disorder. But to me, what caught my attention as a clinician was his ability to sing. He was able to sing with appropriate lyrics, but then he was not able to make volitional communication. that made me think that he must not have a it is like he must he seems to have not language, but then he doesn't seem to when he sings. So although there are different routes of processing, but then I wanted to help, since he's 9 year old, I wanted to help him through writing. But then when I helped him through writing, he was ready to write with support with his wrist, but then he wanted me to play Mr. Beam's title theme. Okay, that's a high pitch instrumental play, and all through his writing he will want that to be played. If at all the instrument stops, the child will stop writing. And I didn't know that this could be related to audio motor synesthesia. But then after I saw this peculiar behavior and went back and read through, I could relate it to audio motor synesthesia. Sound evokes action, and action evokes sound. So this is the first case. And the second child again was diagnosed by 2.5 years. And when I met him, he was 4 years. And when I saw him, he still had language disorder. But then the child had proclivity for rote language, which means that he was good at numerals and alphabets, but then he did not have any voluntary communication. So what caught my attention was his heightened interest towards drawing and simple line drawing for trucks. And he did not have a time lock response with the mother. He had delayed echolalia, what we call it as. Like if I say something now, of his interest, whenever he wants to, he might say that utterance. And that delayed utterance was most often times a truck. And what the clinician, what I immediately did was, having visual schedules of truck, okay, to elicit a verbal response. And in the truck I would place my target word. Say for example, if I want the child to say apple, I'll draw an apple inside the truck, and I'll want the child to name it. And slowly we started getting a time locked response, and his vocabulary was increased even without the truck, which was initial point of stimulation for me. The child started responding. And here is a glimpse of that child's response, and this is played with the consent of the mother. And this is just to recreate of how we worked. The child is now 8 year old, but then this is just to recreate and tell as to how we worked with the child.
What is this, John?
Truck.
What's the spelling for truck?
T-R-U-C-K. Truck.
What is in the truck? What is this?
Apples.
Oh, very good. Okay.
A-P-P-L-E-S. Apples.
Very good, very good. Now what's the next thing we'll draw? Now we'll draw what is this? Amma's drawing something here. Okay, what is this, John?
Bus.
Yes, very good, John.
Bus.
What is this?
Bus. B-U-S. Bus.
Okay, very nice. Now we'll draw another something else. Okay, we'll draw something else. What shall we draw? Okay, wait.
Truck.
Yeah. Truck. Amma drew a truck.
Truck.
We drew a truck.
So if you could notice, the child's mother actually simulated that context which I told. But then as I told you, I met him by 4 years of age. He has good language now, relatively much better. But his nature of imbibing visual schedules have gone to a complexity where he can answer questions now. He's at a good language level from where we started, and he's on voluntary communication right now. So this is how as you see the mother, and he is able to make a communicative response. He was a non-verbal child before. So moving on to the last child whom I wanted to talk about, a child who was non-verbal until the age of 4. And I met this child at 4, but then the child was actually diagnosed at 2 years of age. And to be very clear, the child had visual seeking, and she had a peculiar behavior of making sounds for the orthographic forms in English. She's very much she had a greater proclivity to phonic sounds. So it was utilized for her language, and what she exhibited can be related to grapheme phoneme synesthesia, wherein graphemes induce sounds. Okay, so that could actually help us get a verbal response. So in this case, what we would really do is write a particular word. Say for my, for example, my target vocabulary is apple. So I would write APPLE, then draw the picture, simple picture. No pre-printed materials work well with them, because the moment you show a pre-printed material, they have complex processing that happens. Most often times you need to restrict to what we call it as minimalism, right? So with the stimulus, and that's my experience with all of them almost. So with that, she exhibited hyperlexia. So the ability to, when I started doing it with phonics, it was it was so natural and instantaneous that she could show reading ability without pre-teaching for words, and that is called hyperlexia, reading without pre-teaching. And so we could utilize that for the language. And later on, we do not use any textual context. She is right now in a normal school. Normal school is the so-called school with neurotypicals. She is the topper of the class, and she is in 7th grade. And this is about her. And the final case presentation is again on a child who communicates with numbers. So this was an interesting child where my parents came and reported me that, the child had different, as in they had a different experience with the child, when the child was actually trying to ask them for a number 8 for continuously for a day. Throughout the day he was trying to ask them about number 8. He was constantly perseveratively saying that number 8, and they were puzzled as to why he is asking for 8. And they gave all objects of play, shapes, puzzles, everything related to 8, and he seemed unsettled. And then they had to retrospectively think about for about 48 hours or so as to what this child had done with 8. And when they thought about it, they understood that the child was actually playing in a railway track, which was 8 in shape, which was in shape of number 8, and the child actually meant that. So I think this particular aspect is how language can be internalized with it. This is again a semantic vacuum. The child knows 8, but the child does not know railway track. So what the child has actually done is abstracting that 8 to that concept of railway track. So when I happened to hear this, I started utilizing numbers to get target responses. The child had numbers as rote language, but he did not make a voluntary communication. So then when I wanted to get a target response, what I would really do is I would write a number. Say, for example, apple. Apple is my target word. I will write as 1 apple, 2 bananas. It will be like that. So after a point, when we removed or faded away the number, the child was still able to respond for all the real objects and the pictures as well. And that's how we could get language and vocabulary for this child. To conclude, synesthetic perception is a sensory experience, but it cannot be treated as mere sensory experience. It has ramifications for language learning and processing, and it is linked to changes in the perceptual processing, language, memory, and creativity. And of all the 4 case presentations which I have done in children with autism, you would have understood that rote language is a common feature in them, and that rote language is also a reflection of a corresponding synesthetic perception when we track through or when we relate through the characteristics. And these can be exploited in language intervention to get language, to get a target response. And utilizing these skills in children with ASD can facilitate overall language intervention as well. The main issue of any child with ASD is inability to internalize language, but the very nature of language being abstract and the very nature of synesthetic processing or perception being abstract is the key or is the link for us to utilize it for therapy. And I'm open for discussion, and thanks to the organizing committee for giving me this opportunity. At the outset, I would really want to thank Dr. Pratibha Karant, who had also been a part of this work with me. And all the presented data is my clinic data and personal experience. I'm open to questions.